At the ERIC meeting yesterday, and we do it again today, we had an interesting workshop on tailoring treatment in CLL. And it's very interesting because there are guidelines, but you see that they are not so straightforward, and there are a lot of issues to be considered. And also there were people from different countries, and the access to their therapies is not the same everywhere. So it's interesting to see what we can do. And there are quite a lot of unsolved questions because we have new drugs, but we have to be conscious that with these new drugs we don't have the long-term evaluation of these drugs. So of course everybody would like to get rid of chemo because it is chemo, but at the same time we have very long-term results with chemo, so we know where we are going and we know who can benefit from chemo. But even if we have extremely good results with the new drugs right now, we are not absolutely sure of what's going to happen in the long term. And then what's very difficult it's the sequence of treatment, because if you decide to have new drugs first, then when the patient relapses, what do you do? So it was also interesting because as there are a few options in CLL with chemotherapy, FCR, BR, chlorambucil and anti-CD20, you see that even if there are guidelines, the choice at some frontiers is not clear. For example, in some countries, people will choose BR over chlorambucil, and in some others the reverse, and FCR will not be given after 65 in some places, and much later in some others. So it was interesting to discuss about that and to discuss the reasons why. And then for the new drugs, I think that in the workshop we worked a lot, we talked a lot about the side effects, because finally, as they are very active and they are quite well tolerated, but they have side effects that we were not used to deal with, like atrial fibrillation, for example, for ibrutinib. And so we have to learn how to use these drugs according to comorbidities and also to co-medication. So that was something that we discussed a lot in the workshop.